The spring of 1918 seemed like any other, but a silent enemy was lurking. In crowded military camps, a new illness emerged. Soldiers, weakened by war, were the first victims. This was no ordinary flu. It was far more deadly and spread with terrifying speed. Within weeks, it jumped from camp to camp, leaving a trail of sickness and death. The world was at war, and troop movements helped spread the virus. Soldiers carried the invisible enemy across borders and oceans. By the summer of 1918, the virus had reached every corner of the globe. What started as a whisper of illness had become a roar, signaling the start of a devastating pandemic.
The world was caught unprepared. Medical science had never encountered a virus so aggressive and deadly. Doctors struggled to understand the disease as it ravaged their patients. It was a race against time, a desperate fight for survival against an unseen foe. The 1918 flu virus traveled with the speed of war. It hitched rides on crowded ships carrying soldiers and supplies. It spread through trenches, where soldiers lived in close quarters. No continent was spared. From the battlefields of Europe, the virus traveled east. It reached India, where it devastated crowded cities and rural villages alike. It crossed the Pacific, striking China and Australia. The virus moved quickly, leaving a trail of illness in its wake. People were afraid. They had never seen a disease so contagious and deadly. News traveled slowly and rumors spread faster than the truth. The world watched in horror as the death toll mounted. Hospitals became overwhelmed as the sick arrived in droves. Patients filled every bed, overflowing into hallways and makeshift wards. Doctors and nurses worked tirelessly, their faces etched with exhaustion and worry. Medical staff worked around the clock, but there was little they could do. Medicine was not advanced enough to combat the virus effectively. Resources were stretched, thin masks, gowns, even basic medicines were in short supply.
The virus did not discriminate, affecting young and old, rich and poor. Hospitals became places of both hope and despair, where families prayed for recovery while grappling with the grim reality of the situation.
Fear gripped communities as the virus spread. People were terrified of getting sick, terrified of losing loved ones. The invisible enemy sparked panic, leading to desperate measures. Cities implemented mask mandates, urging citizens to cover their faces in public. Schools, theaters, and businesses were shuttered to prevent gatherings. Streets once bustling with life became eerily quiet.
Public health officials pleaded for cooperation, emphasizing the importance of hygiene and social distancing, a term not yet coined but practiced nonetheless. Funerals were held quickly, with limited mourners, adding to the sense of sorrow and isolation.
Section 5. A Grim Harvest, Counting the Human Cost. The 1918 flu pandemic left an unimaginable scar on the world.
It's estimated that 50 million people died from the virus, a staggering number that surpasses the casualties of World War I.
Entire families were wiped out, leaving behind a void that could never be filled.
The virus did not discriminate, affecting all ages and walks of life.
The world mourned a generation lost, forever remembered as victims of the great influenza.
The scale of the tragedy was difficult to comprehend.
Numbers on a page failed to capture the individual stories of loss and grief.
Behind each death were families shattered, dreams unrealized, and a collective sense of sorrow that permeated every corner of the world.
Section 6. Echoes of the lost personal stories and lasting scars. The true impact of the 1918 flu pandemic can be understood through the personal stories of those who lived through it. Survivors recounted tales of loss, resilience, and the fear that lingered long after the virus subsided.
Letters and diaries from the time offer a glimpse into the daily realities of living through a pandemic. People wrote about losing loved ones, the fear of falling ill, and the disruption to everyday life. These first-hand accounts serve as a poignant reminder of the human cost of the pandemic.
The psychological scars ran deep. Many survivors carried the trauma of the pandemic with them for years to come. The experience left an indelible mark on a generation, shaping their views on health, disease, and the fragility of life.
Section 7. In the pandemic's wake, public health redefined. The 1918 flu pandemic exposed the world's vulnerabilities and highlighted the importance of public health infrastructure. In the aftermath, nations around the world began to prioritize public health measures. New organizations dedicated to disease prevention and control were established. Research into viruses and infectious diseases intensified, leading to breakthroughs in vaccines and treatments. The pandemic served as a wake-up call, prompting a global shift towards a more proactive approach to health. The concept of global health security gained traction. Countries recognized the need for collaboration and information sharing to prevent and respond to future outbreaks. The 1918 pandemic, while devastating, paved the way for a more resilient and prepared world. Section 8. Lessons etched in time, echoes of 1918. The 1918 flu pandemic, though a century past, holds valuable lessons for modern times. It serves as a stark reminder of the speed with which a virus can spread, the devastating impact it can have, and the importance of preparedness. The pandemic highlighted the importance of early detection and rapid response in containing outbreaks. It underscored the need for clear communication from public health officials to prevent panic and misinformation. Most importantly, it emphasized the interconnectedness of the world and the shared responsibility in safeguarding global health. The echoes of 1918 serve as a cautionary tale, urging us to learn from the past and prioritize investments in public health infrastructure, research, and global cooperation. Section 9. A Century's Warning. The pandemic's unfading relevance. A century after the 1918 flu pandemic, its legacy continues to resonate. The world has faced subsequent outbreaks, each a stark reminder of the threat posed by infectious diseases. The COVID-19 pandemic, which began in 2019, brought back haunting memories of 1918. The rapid spread of the virus, the strain on healthcare systems, and the implementation of public health measures like mask mandates and social distancing echoed the experiences of a century ago. The 1918 flu pandemic serves as a timeless reminder of the importance of vigilance, preparedness, and global solidarity in the face of health threats. It underscores the need for continued investment in public health infrastructure, scientific research, and international cooperation to prevent and mitigate the impact of future pandemics.